MS research dates.
Dr. Sean Apap-Mangion.
Dr. Rebecca Smith.
Hello, nice to meet you.
Nice to meet you.
I'm Dr. Rebecca Smith.
And I'm Dr. Sean Apap-Mangion.
Nice to meet you.
Nice to meet you.
This is nice.
Isn't it? So I think that this is our envelope as a conversation starter.
Okay.
Clinical trials.
Oh.
So I think that one's for me.
Okay.
I work on the Octopus trial, which is a clinical trial for people with progressive MS that just launched last year. And the other one says oligodendrocytes.
That might be me. So I actually kind of know a bit about the clinical trial, but I work on the lab side of things.
Okay.
So I actually look at oligodendrocytes, which you'll know are the cells that make myelin. And I'm actually looking to see what metformin does to them, but in a dish.
All right. Fine. So
You're the human, I'm the dish.
Exactly. That links these together. So for Octopus, you know, the drugs that we're testing are alpha lipoic acid, and the other one is metformin.
Yeah.
With alpha lipoic acid, we're looking at the neurodegenerative side of things. So we think that it's neuroprotective. And metformin, obviously, like what you've highlighted, we're hoping will be remyelinating.
Fingers crossed.
Fingers crossed.
Yeah.
So what have you seen from your research so far with it?
What I do is I've been growing oligodendrocytes, and what's different from what we know already is that there's loads of research, but it's been done in animal models. And as you know, you're not a rat, neither am I think. So they don't always come out to be the same when it comes to humans. So it's really important that, as you know, we look at what happens when you treat human cells. So I've got human cells, which have actually derived from stem cells, human stem cells. So I can actually make them into anything. And they're kind of like a blank slate of a cell. And I tell it to become an oligodendrocyte, and it does. And then I give it metformin. And what I'm doing is I'm looking at metabolism, because as you'll know already, metformin kind of works with cells through their metabolism. And what I've seen using a special machine called a seahorse, there were no seahorses in it, I don't know why it's called that, is that I can test how the metabolism changes, what kind of metabolism it has. And so far from what I've seen is that it actually seems to boost these cells and it kind of helps them know to become more oligodendrocytes. And the idea is hopefully that with more oligodendrocytes, you then have more cells producing myelin. So that's what we've already seen, which kind of reflects what we know before from animal models, but yeah. So can you tell me more about what you do for the clinical trial?
Sure. So myself and one of the other doctors, Charlie Wade, we recruit people onto the trial. So people will come on to register for the trial. They have to go online, go to this website and just put their details in. And then depending on what site you get allocated to, someone from that site ends up contacting you to discuss it further. So for UCL, myself and Charlie are the ones that call through. We discuss things with the patients. We can send them ultimately when they can come on, and then we keep following them up over the course of the trials, to see that they're getting on okay with the medications. If they have any questions, obviously, along the way about anything else, and they can raise that up with us too. And then from the, let's say, backside of the trial, what we're doing is, we're constantly liaising with the clinical trials unit, which is the group that designs and oversees the whole trial, making sure that we're being safe, the things that we're doing are sensible, and reevaluate essentially how the trial is designed and any updates that we need to put into it as time goes on. And then from my side, I'm doing research baked into that or into the other trials that we've done, where we're looking at biomarkers, so blood tests that can maybe give an indication of how someone's MS is going, and even the patient-reported outcome measures, so the questionnaires that people can fill in to get a more personalized feel of how their MS is progressing, how it's changing over time.
You said there was like a few kind of centres that you have people go to. Is it just one or two, or where are they kind of based? Are they all over the UK?
So there are 15 sites up and running at the moment across the UK. So those are across all the different nations. This is for the first phase of the trial, because the first bit is entirely dependent on MRI scans. So seeing how much an MRI brain scan shows shrinkage from baseline when they first join us and 18 months later. And after that, there'll be the part which is purely clinical based. So it would be tests of walking, tests of upper limb function. And for that side, then hopefully we'll be opening up to a lot more sites so that more people would be able to come on, and they're not limited to just the ones that we have up and running.
That's really cool. And what kind of people do you recruit? Is it lots of different types of people, or is this like age based where it's just like like from like 20 to 30 years old?
So it's purely for progressive types of MS, so that's secondary or primary progressive MS. And we have an age restriction at the moment of above the age of 18 and up until age 71.
Okay, wow.
Which,
That's really cool.
It's a pretty good cutoff.
Yeah.
Like, most other trials is much less than that. So for this one, there's been a lot of patient and public involvement. And obviously a big concern is making sure that as many people that can come onto the trial do. And so we've had the opportunity to extend it to this degree, which is very exciting.
So how long has it been going on for? Because I know one of the things that I'll be investigating afterwards is kind of long-term metformin. So how long is the trial actually going on for?
So the trial first started in January of last year, but the trial itself is it's called a multi-arm, multi-stage trial. So it is an enormous trial capable of testing multiple different drugs over a very extended period of time. So that's the advantage of it. You set it up once, but then it carries on, keeps on going. You keep putting more and more drugs into the system rather than having to tear it down and build up another one. So you save a lot of time. But that means that any one individual's time in the trial could be up to 5 years, depending on if that early signal with the MRI scan shows that drug is likely to be effective or not.
So you said it's multi-stages. Did you say that there are going to be more drugs? So there's 2 at the moment.
Yep.
And is there aims to have more?
Exactly.
Okay.
Exactly. So as time goes on, the ones that we have put in, some of them might not be effective, in which case, obviously, we get to drop them out early rather than pumping more resources into them. But the exciting thing is that we can bring on more. So actually, I think this ties to a lot to what you have researched with this, cell cultures and how you're assessing them. You're looking at it with metformin, but presumably you can use it for lots of different drugs as well, right?
Yeah. The whole aim is to grow human cells in a dish. I can grow my oligodendrocytes and I can also grow OPCs. And they are really, really important because OPCs, as I said, those stem cells, they can go on and they can either create more versions of themselves or they can become oligodendrocytes, which are the myelin-making cells. So because it's kind of like one set way that you can do it, once you've got them in the dish, you can put loads of different drugs on them. So it's really important for any kind of drug that we have that goes into human trials is to understand more of them. And one of the best ways to do that is to look at them in a dish, which is really cool to look down the microscope, and then you can give them loads of different drugs. Obviously, we want to try and work with ones that we think will be effective. And then that's really important to be able to feed back into the clinical trials, because the more you understand about cells on a molecular basis, gives us a really good idea of how they can work long term and how they affect people. So, yeah.
So, because I know at the moment, like mouse models, rat models, that kind of thing, they're very important for like preclinical decision making to see, what drugs should be brought onto trials. Where do you think, these progenitor cells and the oligodendrocytes, that level should be brought in? Do you think it gives us a more accurate idea of how effective it's likely to be in people?
So normally it kind of, a lot of the time it comes afterwards. So the thing that is kind of be the negative side of just looking at cells is we are made up of lots of different type of cells and even involved in remyelination, so rewrapping myelin around those nerves, is that there's actually more than one cell involved in that and they kind of help each other out. So it's really, really important that when we're looking at metformin, we don't just focus on one cell because there could be negative impacts on different cells that are involved in it. And although it might be really great for the oligodendrocytes, there's another cell that's called an astrocyte and also a microglia that are involved in it. And if they're really sad afterwards, that may not be ideal. So we normally do animal models because they have all the different cell types. And a lot of the time they are similar to what we have as humans. But the best way to test the cells and how they would work with us in humans is to take human cells. So I guess normally it's really great to have them in tandem, but the way it normally works out is that it's easier to kind of look at them in animal models. And then when we've kind of got a better idea of how it's going to look, it means that we can take those drugs and try them on human cells, and then we get an idea from there.
Cool.
Yeah.
Very, very cool.
Yeah, so hopefully all of our work will come together.
Well, Becky, I've been told to bring something along to this, and I don't know about you, but I wasn't sure how to bring a clinical trial with me. So instead, I brought...
It's an octopus!
This is actually my favorite octopus because we're hoping to make it a little Easter egg that just finds its way into the back of every video that we take.
Does it have a name?
Actually, that's a good point. We haven't given him a name. There's one person that we've got in the trial who, she's very prolific, and she's got one that she's taken across all different places in the UK and keeps posting about it as well. So I think she brought it with her to an interview at Downing Street.
This octopus is more well-travelled than me
It
in
is
this
very
country.
well-travelled.
Do you know what? That's fair. I'll allow it. Well, thanks for bringing him.
Community question.
Hi Becky, hi Sean. I hope you're enjoying your dates. I'm JJ, I have progressive MS. So my question to you both is, how inclusive are the trials when it comes to gender and race? And will there be an adequate amount of ethnic representation? Thank you.
So what we're definitely trying to do is to find out who is coming onto the trial. So, it's open to anyone and everyone across the UK to register. And then we simply go through people as they've signed up for it. But it is something that we're definitely very interested in. It's information that we are collecting as part of the trial itself. So that as it goes on, since it's such a long trial, we can gauge and see who is coming on board, who is interested, who are we missing? So we can try and make it as representative of the population as a whole.
Is this something that potentially with people living with MS that it can potentially lead that you don't really have like a big mixture of people? Because I know that accessibility will be a really big factor for this. So is there things that have happened to help people who have accessibility issues?
Well, I think this is one of the reasons why we want to try open up to as many sites as possible. Because obviously if you do have more sites in more remote areas or places where it's much more difficult to get to, let's say, a trial centre, then it just makes it a lot more accessible. But it's an ongoing iteration, really. So I think it's something that we're actively looking at and that we're going to keep looking at and keep working with the MS Society and the PPI groups to make sure that we can reach as many people as possible and to keep it as broad as possible.
Yeah, amazing.
So one thing I want to know is, what is the next drug that you're most interested in testing?
I mean, that is a tough one. I would actually like to be able to test most of the drugs that will be involved in the octopus trial, just because I think that it all links really well to each other. But I imagine you can't tell me what they are if you know them already.
I am just as in the dark.
Okay, well, I could go for the lipoic acid, but just because I think at the same time as you said, the metformin is really looking at protecting that myelin and the oligodendrocytes. But as we know, it is really important to look at drugs that are there for like nerve repair and protecting nerves. So yeah, it'd be really amazing to see what any of the drugs are involved there. So I'll see what cells I can grow in the dish and I'll get back to you. One thing that I would like to know about you is what led you to be involved in the octopus trial?
Well, I think honestly, just very good luck. I was working at Queen Square at the time. I knew I always really wanted to work in MS and do more research in it. Luck would have it that Professor Chataway was around and there was a slot going to be opening up. So it was a really amazing opportunity. So even the timing, it was just as the octopus trial was going to be launched, because it's been such a huge project, it's been working on for years. So yeah.
Well, good luck with it.
Thank
Hopefully
you
amazing
too.
things will come from it. It's really exciting.
Well, I look forward to maybe getting the update and seeing what you're doing with the cells.
I'll give you a call.
And the final question, would you be going on a second date?
I mean, she's into metformin. How could I say no?
We've got so much in common, as long as you bring the octopus.
Find out more about history-making researchers at mssociety.org.uk/history-makers.